Good morning, good afternoon. It may very well be a good evening to you from wherever you are joining us today. I am thrilled to be back on your screens with Pulse with Dr. T. And today is especially an important day for us because we know that December 10th marks the 75th anniversary of the Universal Declaration of Human Rights, which protects and fulfills individuals' rights to quality contraceptive information and services. So, welcome everyone, old friends, new friends, the community of family planning, to this exciting webinar on transforming family planning, moving towards a stronger human rights-based approach to the topic, of course, of family planning. And I'm especially excited today because I will be moderating this discussion for you. And we have a lot of amazing panelists who will be joining us who have a huge strength and experience in human rights-based approaches to family planning. This discussion is very, very important for us because we know that not just as practitioners of family planning, as doctors or nurses, but we know we have activists as well and policymakers who are very important to this discussion of family planning. And today we are going to be bringing you a moderated discussion that I'm going to be introducing our panelists to. But more importantly, we want to move from just beyond the theoretical discussions, but also give you some practical tools and guidance in how to move towards a stronger human rights-based approach. And this will happen in the form of UNFPA's cutting-edge support tool that will be shared with us today to give us some ideas, inspire us in our daily work, and how we can infuse and make sure that we are truly transformational when it comes to human rights in our programming, and as well as learning about best practices when it comes to family planning. I think what's important as well is to recognize that this webinar, of course, happens at the backdrop of the 75th anniversary of the Universal Declaration of Human Rights. And you may be wondering, why is family planning a human rights issue? Why does a human rights approach need to be strengthened in the very first place? And why this is a human rights issue is because we know that under the right to health, sexual and reproductive health rights are an integral element for everyone's attainment of the highest attainable standard of health. And when you are thinking about women and girls and everyone who requires hormonal therapy and contraception, we know that there are a lot of obstacles, either in clinical care, at the level of health systems, in terms of commodities available, but as well as underlying determinants of health. And we know that when systems fail, when human rights are not protected or promoted or fulfilled or even realized, we know that they impact the key principles of non-discrimination, the key principles of autonomy and decision-making, the key principles of meaningful participation, but also transparency and accountability. And I'm thrilled that even on our webinar today, we do have people who are working at the level of governance and health systems, where we can start to talk about health financing and health sustainable solutions around contraception and making sure that they're accessible, acceptable, affordable, but also of quality. And so without any waste of time, I want to introduce you to the panelists of today. And I'm excited to start off with Uluk. Uluk is a young person. I'm not as young anymore, so I'm glad there are more and more young people in the family planning community and family who will take over the baton. And Uluk is one such young person, an international trainer, consultant on SRHR and a media influencer. He's a health officer at the Eurasian Coalition for Health, Rights, Gender, and Sexual Diversity, and a board member of various organizations, but also the focal point of Family Planning 2030 platform, and has extensive experience, more than 12 years, in SRHR, family planning, comprehensive sexuality education, as well as HIV. And my second panelist is Emily, who I've also worked with quite a lot at UNFPA. And Emily provides leadership and advisory support for UNFPA's human rights work and efforts to truly leave no one behind. You guys know that slogan so well. And I think we are being intentional in making sure that we leave no one behind. And Emily, in her daily work, advances research on the nexus between women's rights and sexual and reproductive health. And with over 18 years of experience working with development organizations on human rights mainstreaming. This includes, of course, being a policy specialist at the UN Development Coordinator Office at the UN office in New York, and managing UN systems, human rights-based approach training for UN system staff as well in Italy. She has amazing experience as a technical person, but also someone who's truly passionate and committed to human rights and how at the intersection of family planning as well. And Emily will be our first speaker to take us through the tool that we'll be discussing today. And our third panelist is Zuhura, who is a public health specialist with a nursing and midwifery background. You guys know we love nurses, we love midwives. So Zuhura, welcome. Nice to see you again after Pattaya. And of course, with your experience of over 15 years working in the reproductive health field, particularly in family planning, adolescent health, and youth and sexual and reproductive health as well. You are working currently at the Ministry of Health in Tanzania as the National Family Planning Coordinator and the governmental focal point for FP 2030. I think you can see by the kinds of panelists we have, we are really trying to cover a widespread range of stakeholders. And we will hear from you, Zuhura, from a governmental perspective. What are your challenges, but also what are the innovations that you are currently embarking on, especially with your extensive experience with implementing partners and civil society as well at subnational. And my fourth and final panelist will be Elijah. And Elijah is an advocate of the High Court of Kenya with diverse experience in strategic programming, advocacy, monitoring of human rights. I think it's important to also think about the national commissions of human rights across the world, but also in the countries we all come from, and think intentionally about how we can bring those closer to the family planning conversation. And Elijah is important for that because he serves as a senior human rights officer of the Kenyan National Commission on Human Rights, which is based in Nairobi. And Elijah is in the Division of Reforms and Accountability. I like hearing the word reforms and accountability because it means that we understand that there may be things that go wrong, but how do we analyze them and how do we make things better? So with that being said, welcome Elijah, welcome Zuhura, welcome Emily and Uluk to this amazing conversation. And I'm very excited to be having this with you. And again, welcome to our community. And I see people are telling us where they are from in the chat. Please feel free to do that. The moderated conversation today will be available in Spanish as well as in English. So look for the globe sign on your Zoom for interpretation and choose your language that you prefer. And I will be also, together with the team, going through over the chat, seeing your comments, seeing your questions. If you already have some stuff that's inspiring you, please let us know those comments so that we can share them also with the panelists. And I know that the family planning community is very interactive as well. So we will be keeping an eye on that chat box. And again, welcome everybody. And as we kick off, I want to hand over to Emily, who's going to take us through the tool that they have designed and why this has been an important for UNFPA as an organization to bring us this practical guidance, right, as we move beyond theory. And why is it important for family planning right now to be your focus? So Emily, I'm going to hand over to you now as you start over your presentation. That will be followed then by a moderated discussion with the rest of the panelists. Over to you, Emily.
Thank you so much, Dr. T, and for setting the context so well on why this is such an important issue from a human rights perspective, why family planning is central to realizing the right to health and the right to gender equality and many other rights. So for us at UNFPA, we've been deeply committed to integrating human rights in our family planning work for a long time, really since 2012, when our first strategy explicitly called on mainstreaming human rights. And so we've done a lot of different initiatives to support the capacity of our staff and our partners to do so. And then in planning for our new strategic plan that we developed, we first did an evaluation of our family planning work. And in that, and this was in 2020, and from that evaluation, we found that although we were committed to human rights-based approach, at the country level, we were struggling to really move from rhetoric to action. So we have great policies, we are committed, but translating that methodology, translating that commitment into action has proven more difficult. And what we found in particular was that the focus on human rights-based approach meant that we found that our country officers were focusing on some aspects, in particularly services, supporting quality services, supporting different choices of contraceptives, all very important, but also not looking at the more comprehensive parts of a human rights-based approach. So working at the individual level, women's bodily autonomy, working at the community level, working on issues of non-discrimination. And so we weren't being comprehensive. Secondly, there lacked a definition of a human rights-based approach to family planning. We talk about it a lot. We say human rights to family planning, but concretely, how do we define this? And do we have the same definition across the organization and with our partners? So we needed to have a concrete and clear, coherent definition. And thirdly, we found that although we were working on different elements of a human rights-based approach, we weren't doing it systematically or explicitly. And Dr. T, you just mentioned that. We need to be intentional. It's not good enough to do it without having a concerted effort and explicitly using that approach and that human rights lens. Because if we're not being explicit, then we're not maximizing the impact that we can have in applying a human rights-based approach. So with those findings from the evaluation, we developed this tool. So what does this tool do? This tool firstly provides a definition of what do we mean by a human rights-based approach. And here is our definition. We state that a human rights-based approach to family planning, it's a conceptual framework and it's systematic. It has to be applied at all phases. It's not good enough to do it at the beginning of the program and then we forget about it. We need to be systematic at all phases and at all levels of our work. And we're framing it in an understanding that states have international obligations under international human rights law to ensure that those rights are respected, protected, and fulfilled. And we need to maintain a focus on key human rights related principles throughout our programming phase and at all levels of the programming. And in the next slide, I'll take you through those programming principles. And we need to work both with the duty bearers, so the service providers, the government, to ensure that they can fulfill their obligations, but we also need to work with the right holders. We need to work with individuals to empower them to make those decisions. So we need to work both with the duty bearers and rights holders, or as sometimes we say in this world, with both at both the demand and supply side of family planning work. In terms of the human rights standards and principles, and Dr. T, you mentioned them before, but these are 10 principles that we see as key to family planning that we need to apply systematically. And firstly, we're looking at what we call the triple AQ that come from the right to health. So the need for services to be available, accessible, acceptable, and of good quality. We need to keep a constant focus on non-discrimination and equality, support bodily autonomy and agency, ensure informed decision-making, support privacy and confidentiality in the way services are provided, and strengthen accountability and the participation, particularly of those that are furthest behind, to be part of the planning and programming. So these are the 10 principles. And if you move to the next slide, please. Then the tool that we have outlines what a holistic framework for human rights-based family planning is. And it's divided into these 4 levels, and it asks us to work or to assess our family planning program from these 4 levels, ensuring that those 10 principles are applied and reflected in each one of these principles. So we start with the empowered and satisfied client. We're working at the individual level and promoting those principles at that level to ensure that every individual right holder has agency and is able to make her or his own decision-making in a private and confidential and respectful way. We work at the service level, ensuring that services are provided in a quality way, in a non-discriminatory way, and that we address access barriers. We look at the legal and policy environment, ensuring that laws and policies ensure full and equal access, but are supported by sound budgets and institutions that can implement the policies that have been put in place. And lastly, the community level and working on social and gender norms, which is so important, working to support rights literacy, working with media and other and faith-based organizations and others that can really influence the community and inform decision-making of individuals. So working at all of those levels and looking at how these rights, these principles have been implemented at those levels. And so this tool, what it gives us a way of systematically assessing of family planning programs to identify what are our strengths and what are our weaknesses, and how we can then develop an action plan in each country to address those strengths and weaknesses. And we just rolled it out in Tanzania, Uganda, Kenya, Mozambique, and Kyrgyzstan. And you'll be hearing from my colleagues on that. And then lastly, to say that this tool is then an integral part of our new family planning strategy, which is about expanding choices and ensuring rights in a diverse and changing world. So it accompanies our family planning strategy and our vision for ensuring rights and choices for all. Thank you.
Thank you so much, Emily, for that. And I love also the colors and how graphic everything is, and it makes it so much easier. And I know sometimes when you are in the primary healthcare clinic, you really just go for the tools that you can easily reference and get exactly what you need in that moment with your patient's consultation. And I know that often we talk about the big sort of stuff around family planning and access, but even the quality of that interaction between doctor and nurse or patient is so, so important. And I see how this tool is particularly important to also enhancing those interactions, those consultations, so that patients have information they need to make informed decisions. They know what to expect in terms of, how the contraceptives work, but that the nurses and doctors and other healthcare workers themselves are informed with the latest cutting edge, information that's available for them. And I think for as long as we can keep up that continuous education and making sure that we also don't leave health workers behind in the conversation, I think it's a really, really great, step in the right direction, especially when we're talking about human rights. And of course, now with my first panelist, Zuhura, and Zuhura, of course, works at the Ministry of Health in Tanzania. She is a focal point, but also has extensive experience in adolescent and youth health and services in SRHR. I think you are perfectly placed to come on after Emily has presented this tool. And thank you very much, Emily, to make us understand, as a Ministry of Health in Tanzania, what are the different elements that you use to apply human rights-based, lens in your work in Tanzania through the ministry, and what were you trying to address by adopting a human rights lens, to the work that you are doing? Over to you, Zuhura.
Thank you, Dr. T, for the question. I think we all realize that the issue of human rights is not a new thing to most of us. The new element that I think has brought into the program is a better and a more comprehensive understanding of the concept of human rights-based approach. This goes beyond the 9 traditional elements that we use to practice in our service delivery points, such as informed decision, privacy, confidentiality, quality of service, accessibility, affordability, non-discrimination, acceptability, participation, and the accountability. The following the human rights-based approach workshop, we realized that we also needed to understand the broadly thing concerning the human rights-based approach. We realized that the principles like agents, autonomy, and empowerment, being a standalone principle in the supporting tools, makes us well understand the whole concept of human rights-based approach. Like in our national family planning documents, such as National Family Planning Standard and Guidelines, as well as in the National Family Planning Message Guide, they incorporate almost all the principles and standards of human rights-based approach to family planning programming. The principle of agents, autonomy, and empowerment are not vividly reflected among the principles and the standards of human rights-based approach in our documents, but we typically practice them every day when providing women when making informed decision choices. Having a standalone principle now of agency, autonomy, and empowerment helps adolescents to realize their sexual and reproductive health rights. This better understanding of the whole concept of human rights makes the phenomenon of human-based right-based approach to family planning program well practiced and more remove some of ambiguities among FP stakeholders in terms of what the program means when trying to address issues of human rights. That's what I can say, what we get from the workshop and those elements stipulated in the supporting tool. To you, Dr. T.
Look, I'm coming to you next, and my question is based on your experience as, of course, a civil society member, but also an activist, and also in your own right, an expert in this area. And being a young person, after hearing Zuhura and listening to the tool, what are some of the opportunities that youth see, right? This tool provides, but this perspective of human rights provides. And how do you see your role as civil society to ensure that family upholds human rights?
And I think this tool opening lots of opportunity for not only civil society organizations or young people, but also directly for the clients, because it's directly linked to the dignity of a person, dignity and human rights and freedom and values of the each person whom we are working in healthcare sphere. In my understanding and view of perception of this tool, that it's really great tool which were implemented in Kyrgyzstan. We try to collaborate with Ministry of Health, with academia in healthcare sector, with civil society, and also, of course, gynecologists and healthcare providers who are in the front line. And we were together having these dialogues of different perspective on how we can move forward this human rights-based approach in family planning, because family planning has a direct linkage to human rights, and human rights is also covering reproductive and sexual rights, which are also concentrating not only about the quality of the services, what kind of different supplies, etc. we have, but also what is the attitude for the clients of healthcare providers, what is the key elements when we are talking about human rights. One of the examples of violation of human rights, for example, what is happening in healthcare system, for example, is a confidentiality. When we are talking, especially adolescents, girls, when we are talking about the young women who are having lots of stress and pressure from the society of being, for example, pregnant or being, and even it's more difficult when, for example, these girls and young women are pregnant when they don't have, for example, marriage, etc. And in this regard, it's so important for healthcare providers not only give the quality services, but also to keep the confidentiality, to put these clients to the center and to the top on this all healthcare issues. Regarding also another aspect of this tool, what is really helping for us, for civil society, is a dialogue between the government and between the civil society organizations, because in this regard, we can also move this agenda not only in national levels, not only with governmental representatives who are basically might understand, for example, what is human rights is, but also work closely in collaboration with different gynecologists, obstetricians, and other healthcare providers in the rural areas to educate them, to give this to not shrinking, but enhancing the spaces for professionals, healthcare professionals, in advance of understanding of what is human rights and why it's so important in family planning.
Thank you so much. That was brilliant, because it takes me then straight to Elijah, and being, of course, working at the National Human Rights Institution, you have a lot of stakeholders that you are dealing with. So I want to hear from you, Elijah, in your perspective, the Kenya National Health Rights Institution is one of the few national human rights institutions in the world that is helping to advance sexual and reproductive health rights. Can you tell us, from your perspective in this institution, why is this a priority for you?
Thank you very much. From the perspective of the Kenya National Commission on Human Rights, sexual and reproductive health rights are a critical issue that we put as a key priority because it is interlinked to not only development of the population, but also it is so interlinked with the realization of human rights. So when we have our population have enhanced rights to education and access to information, then they can realize some of the family planning needs that they have, from couples to individuals, and also to ensure that the realization of the universal health coverage would ensure that every individual, including adolescents, have the full range of sexual and reproductive healthcare services, and so that reproductive healthcare can be realized and also attained from the perspective of ourselves as a human rights institution. Also, the need to look into the right to life, especially in terms of preventing maternal mortality and morbidity through safe motherhood programs, and also to ensure that women and girls who are adversely affected are protected from harmful cultural practices such as female genital mutilation and also early or forced child marriages. So to us, the whole spectrum of the realization of sexual and reproductive health rights is very key to us, and also, of course, part of it is the realization of family planning. And we are very happy and excited that this tool that has been developed and is being piloted within our jurisdiction is something that is breathing life towards the right direction in terms of realizing human rights and also specifically sexual and reproductive health rights. As a commission, we've also delved into sexual and reproductive rights by conducting a public inquiry to assess the extent to which our country is meeting its obligations. And we sought to look at some of the laws and policies, whether there is an enabling environment to realize these rights, and also with a view of also removing or advising the state to repeal some of the laws that might be viewed as discriminatory. Also, we needed to gauge the extent to which our government or some of the commodities that would realize sexual and reproductive rights are accessible to the population, and also to look at how human rights-based approach principles are infused to the current existing strategies that the government has employed. And so through these analyses and inquiries that we undertook, it involved a lot of desktop research, field interviews, public hearings, and the invitation of memoranda and also media campaigns. These enabled us to have a fair view of the status to which our country is at. And as at that time, earlier in 2012, we were not compliant in terms of our dedication or our obligation and commitment to provide the maximum resources so that to realize sexual and reproductive rights. Also, other groups such as sexual minorities were still discriminated, and also persons living with HIV and AIDS, and adolescents, and also refugees and internally displaced persons. So then some of the recommendations that we were making to the state is the need for that expansion of access so that we have a broader mix of family planning methods available to couples and individuals whenever they want to make decisions relating to the spacing of their children. and also the need for a strong investment towards the community structures, such as the community health professionals, which we are happy at the moment. There's been some law review, and to enable that, as this would enable the ease of access in terms of delivery of family planning services. In addition to that, also to the cost in terms of accessing family planning services was quite high for the majority of our population, and therefore we are calling for a review for a significant reduction of the fees associated with the same. And also there is a need to still address some of the deeply rooted cultural barriers to family planning, and also to the protection of women and girls against harmful practices, such as child marriages and also female genital mutilation. And we were also recommending that, from our perspective, that the availability of accurate information that is also sensitive to the diverse cultures and also diverse communities, and the age differences should also be made accessible to the various needs of the population. And the integrating of family planning as a realization of sexual and reproductive health rights to be part and parcel of the broader development agenda for our country. So those are some of the concerns from the human rights, the Kenya National Commission on Human Rights, and which we continue to engage with health facilities to try and see what capacities they do have, and try and work towards developing an improvement plan from their perspective, and also the ensuring that we enhance the sustained monitoring of compliance to not only our national laws, but also to our regional and international obligations that we have made as a country. Thank you.
Thank you so much, Elijah. And I'm just gonna take a moment to remind us all that we can use the Q&A box at the bottom of your screen on Zoom to send any questions to the panelists, and we will be taking those questions very shortly. And of course, you still have the interpretation available to you in Spanish and French. And I'm going to take one round of questions again to the panelists. And at that point, we will then come back and then have some interaction with you based on the Q&A. And just to say, it's so exciting to see how many people have tuned in. People from Tanzania, Guatemala, Rwanda, as well as Ethiopia, Cameroon. We have people joining us from the DRC, New York, from Sudan, from Nigeria, Ethiopia again, Peru, from Afghanistan, from Maryland. So welcome everybody. So exciting to know how far we are having this conversation. And of course, Niger, Haiti, hello, and Liberia, Johannesburg. I mean, really, really exciting and fascinating to see the reach of this family planning community, but so important, the impact that we can have across the region. And I want to come back to you, Zuhura, because I want to know, just from your perspective, having listened to the other panelists, but also from your own experience, right? We know that this human rights-based approach tool to family planning is really, really important. And as someone who works at the level of government and governance, we know it's important to translate a lot of the international indicators and the goals and the agreements into national-based plans, right? That you can then implement even at the subnational and district level. So you, from the Ministry of Health in Tanzania, are committed to addressing the unmet need for contraception. We know that many governments are struggling with this. So how do you see this tool going to be important for you to advance that goal, the human rights-based approach to family planning? Thank you, Zuhura.
Thank you, Dr. T. The supporting tool for human rights-based approach is very helpful and aided the review of family planning program work using its framework that shared by Emil. The two assisted family plan stakeholders identify gaps, challenges within the lens of human rights-based approach, and prioritize key intervention in various thematic areas to complement the attainment of FP goal. This applies to the need for the availability of commodities, supporting police environment, human resources, and community engagement. The 4 programmatic levels of the framework guided us to develop the action plan that will be used by stakeholders to advance family planning right-based approach to achieve the goal. The 4 levels that are shown in the framework. Like in this December, we are in the process of conducting an end-line assessment for national family planning costed implementation. The finding of the assessment of CIP, together with the assessment we conducted on human rights-based approach during the workshop, will be combined to inform the development of new CIP, new National Family Planning Costed Implementation 3. These efforts aims to mainstream human rights-based approach issues into the unified and standardized plan for the implementation of family planning intervention for the next coming 5 years. We also shared the work plan that we developed in the workshop to the partners to be able to incorporate in their plan. If you happen to see our FP 2030 commitment, you can find that one of the commitments that we made in FP 2030 was regarding having high right-based family planning services. The human rights-based approach too has sharpened our understanding, which has facilitated the review of strategies for fulfilling the implementation of the commitment that we made through incorporation of action items into the human rights-based approach plan, and we to sharpen our FP 2030 action plan to ensure that we if all issues of the assessment that we made during the workshop for human rights-based approach. That's what I can say, how the tool has helped us in realizing the issues of human rights-based approach in our program.
Thank you very much. And I look forward to visiting you in Tanzania to see some of these amazing programs that you are busy with. And coming back to you, Uluk, how can civil society, and especially young people in particular, hold governments to account in terms of their duty to providing a human rights-based care to family planning in general?
I think it's most important, especially in our during time when we have so many shrinking space for civil society, when we are having lots of trouble with democratic institutions over the world. It's so important to keep fighting for the rights, keep fighting for human rights. And yesterday on the 10th December of celebration of anniversary of Universal Declaration on Human Rights, it's so important for us to keep having a dialogue with the government representative, to demanding, to building these platforms when we can collaborate and we can demand. And of course, there is a lots of and key role, in my opinion, for international society, for international mechanisms when we are using different international commitments of the different governments to say that, hey guys, sorry that you are we are disturbing you, but you are, for example, violating, and you should, for example, apply this or that guidelines into your work or into your government system. And in here, for young people, especially when we are left behind most of the time, and when I'm telling about the young people, we should always be in mind that it's a really diverse group with a really diverse needs and diverse expectations. And of course, it's so important for the government also to listen to this group. And in this regard, for civil society organizations and for young people, adolescents, it's so important to keep this dialogue and to highlight the importance of human rights, not only in family planning, but all services. And I see one of the questions was related to universal health coverage. It's also important to use such as ICPD platform, such as universal health coverage platform, such as, I don't know, different platforms where the governments could also be accountable and transparent under civil society organizations who are joining these events.
Thank you very much, Uluk. And then Elijah, I'll come to you next, and I will then offer the opportunity for all of us as panelists to then go through some of the questions we've received in the Q&A. And just from you, Elijah, speaking about the process, the action plan derived from that workshop, how do those support the recommendations of the National Human Rights Institutions, especially in Kenya, talking about SRHR specifically?
Okay, thank you very much for your question. In terms of the action plans that we do have as a country, and then towards the realization of sexual and reproductive health rights, as a country, the coming together and having the multi-sectoral approach towards the realization of sexual and reproductive health rights gives us the opportunity and the platform for agencies that work on sexual and reproductive rights to come together and ensure that these action plans are realized. And also specifically from our perspective is the monitoring aspect that we do have as an NHRI, similar to other NHRIs globally, is to ensure that the protection mandate and also the monitoring mandate in terms of the realization of sexual and reproductive rights is sustained. This is also realized through the advocacy, through assessing, conducting further social audits to ensure that the commitments that our country has made, especially right from the ICPD commitments and also the current commitments that our government has made, for example, the eradication of FGM by 2026, and also the realization again of the universal health coverage for majority of the population. And so with that, you could systematic move towards improving the access for commodities and also the access for coverage and realization of sexual and reproductive rights. This can only be sustained by ensuring that we all work to move together as different agencies, and ensuring that with that multi-sectoral approach and also an oversight mechanism from both the government and also the other players within the sector, such as the respective ministries of health and gender, would enable most of these rights attained. And from our perspective, we've also been sharing advisories occasionally, especially where we have found gaps and we found that the government needs to place more priority or make the necessary steps towards the realization of these commitments. For example, I would cite the Maputo Protocol, the reservation note that had been set there, that which affects women who may want to access the right to safe abortions in cases of incest and rape. These advisories have gone a long way in terms of also shaping the kind of the reporting cycles and also the commitments towards the realization of sexual and reproductive rights. Also through the regional mechanisms we do convene and the universal periodic review that we convene as various stakeholders to come up with shadow reports against what our state submits to these various committees. And these have been good platforms. Having the affiliate status as a commission enables us to also put into perspective some of the concerns and the human rights concerns that are relating to our country, and also enable the states move towards the right direction in terms of realizing these sexual and reproductive rights. Thank you, and over to you.
Thank you so much, Elijah. And I'm going to move now to then have a discussion with you all virtually, taking care, of course, of your Q&A and the comments that you are making in the chat. And just to also say, we have people from Myanmar, Cameroon, Finland, Honduras, Zambia, Cameroon, Ethiopia, also joining us. Welcome, everyone. And thank you very much for staying with us for this conversation. And I think maybe the first question I can start to answer, it was a question about surrogacy and in terms of human rights and to what extent is it a right to have a child. And I have answered and dropped a link into that chat box around the human rights perspectives concerning surrogacy. And we do have an independent expert at the UN who has dealt with this question, and they do locate it very squarely in terms of human rights, but also protecting the rights of those children, the people who are pregnant, who are surrogates, and just giving us a framework on how to approach that. So indeed, it is an important question, important theme of surrogacy, as we know that as humans, we have a right to benefit from scientific development, but that there are many reasons why people may not be themselves be able to carry their own pregnancies to term. And so we know that it is important to think more broadly about solutions and modern solutions to birthing and where family planning itself falls in. And I think, Luke, you started to answer this briefly in your remarks about universal healthcare planning and universal healthcare coverage. And just to say that, UNGA this year had a high-level political forum that discussed universal healthcare coverage. And some of the important work that I know the community has done in the different low-income and middle-income countries, especially in civil society and academia, is to actually put inputs to that process, ensuring that family planning is not forgotten as an essential services when it comes to universal healthcare coverage. But I think maybe I can come to you, Zuhura. There is a question here about how do we promote sustainable adolescent-friendly hospitals? And I would perhaps even add clinics, right? Because we know family planning is a primary healthcare clinic issue more than a hospital issue. But there is a question around promoting sustainability for these services. Zuhura, maybe you can give us your perspectives, and I will invite all the speakers to have your videos on for this Q&A session. So Zuhura and Elijah, Emily, if you can have your videos on, and then we can have this conversation together. Zuhura, if you are here, any ideas about sustainability, especially for youth and adolescent services?
Yeah, youth and the adolescent sexual services is among the services in the reproductive and child health clinic. So it's it's not like a new service. Is within the package of reproductive and child health service. So it's provided in the clinic, and its sustainability is because it's provided in the public facilities, the same premises like any other services of reproductive and child health. As well as we have centers that is some of the centers are in the public, and some of the centers are managed by private facilities. So as a Ministry of Health, we all coordinate all the services together, despite of it is provided by the private, it is provided by the public. So our mandate is to oversee what is going on even in the private facility, and they are using our national guidelines. They don't have their standalone guidelines to provide the services. They use our standards and guidelines that we provide from the Ministry of Health. That helps in its sustainability of and continuity of the youth-friendly services in our centers, including private facilities.
Great. And Emily, if we can come in here, having presented the tool, there is another universal health coverage question, and it's speaking about how do we ensure the link between UHC and family planning to ensure right to access to family planning to everyone.
Yeah, thank you. I mean, I think, one of the key aspects is understanding that these are rights. And when we are negotiating around UHC, that states have obligations around sexual and reproductive health and rights, and to advocate to ensure that those obligations are then translated into their UHC plan. So really starting from that premise of rights, and it gives us so much more authority and negotiating power when we have understood it as not a good thing to do, but an obligation. So I think that is central. And then what a human rights lens can help us do is address the structural issues behind lack of access. And it also goes to the question that colleagues asked about the links with maternal health, the links with harmful practices and human rights-based approach, because we're looking at not only are the services provided in a respectful and a quality way, but can women make their own decisions with their partner on contraceptive use? What are the gender norms at the community level? Looking at all those issues which impact access to services. So we're pushing UHC to go also beyond, squarely the services, but understanding that we need to also work beyond just the health sector and work at the community level, at the individual level, to ensure that women and girls know their rights, are empowered, and can make those decisions, but engaging men and boys as well in the process of the work.
Great. And I've got two more questions, and I'm going to ask Uluk and Elijah to take parts of the answer to those questions. And I think, Elijah, when you were presenting, you may have, inspired some of the questions. And someone is saying that thank you for laying out the practical ways that Kenya is planning to protect rights to safe abortion access. It's also would be interesting to hear if Tanzania is protecting rights to post-abortion care as well. And Ulu's perspective on this is also important from a perspective of youth, and just also talking about, of course, the legal frameworks, right, that enable access, but also that protect the rights to family planning. And how do we then make sure that the lack of policies or guidelines, especially for adolescent sexual and reproductive health, and trained care providers with governments, enables them to actually do more, because some people feel that, the legal framework doesn't quite enable healthcare providers to do more. So on the one hand, Elijah, give us some ideas around safe abortion access, but also legal perspectives on how do we support governments in making sure they have access. And Uluk, from you, from a youth perspective, what do you think about post-abortion care services as well as adolescent and youth-friendly services then, in how you should be advocating for more legal protections? Over to you, Elijah, and then Uluk.
Thank you very much. From my perspective, I do believe that the right to access abortion is a critical right that should be made available for women and girls, especially women who are in crisis. And there are various legal frameworks that permit this. And I would just contextualize it to our Kenyan situation, where it is permitted, but only when the life of the mother is in danger, or when there's a crisis in relation to the opinion of a health practitioner. And so for us to ensure that this right is realized, is that we need the specific enabling environment to permit medical practitioners to carry out these procedures medically, in the sense that within a framework that protects them, so that they are not criminalized, and also to protect also the women and girls from back alley abortions, where there's no framework or any form of accountability, and increases the risk to them realizing their sexual and reproductive rights. And so in terms of assisting the government, there's that balance between what the law provides for vis-a-vis other cultural and also religious norms that usually create some form of tension. And
Hi, Elijah. I think Elijah is a bit stuck. And in the interest of time, I'm going to ask Uluk if you can hear me. Just come on. And from a youth perspective, and you spoke a little bit about LGBT youth as well, how important is legislation, national guidelines to support healthcare workers to be able to give us the services we need? Over to you, Uluk.
Thank you, Dr. T, and for everyone who has raising this issue. And it's really important one because, as we all know, the government should protect, fulfill, and also promote human rights. And when we are talking about the legal frame in the different countries, this is the essential that people can go without any limitations in the legal perspective, without any scares that they, after the having a health service, they will go to the detention, they will go to the jail, or other harmful legislative practices in different countries. And I think it's so important for us to note that when we are talking about the health, it's more about when governments are creating the environment, creating a spaces. And when we are talking about the adolescents and young people, we should understand and also take that they are independent bodies, they are independent minds, and they are independent souls. So in this regard, it means that we should also create a safe spaces and safe legal environment around the family planning and any other SRHR services. Because, for example, just imagining 15 years girl in country where the legislative framework is really harmful for her, she will go and she will do that services despite all the facts, but these services could be really dangerous with her health and for the future of her body, etc. So in this regard, it's so important to keep conscious the government, the people who are taking the decision. And usually it's a heterosexual men who are taking with the privileges, for example, the decisions which are not, for example, couldn't, for example, fit to the shoes of that girl and couldn't understand why it's so important to keep confidentiality or anonymously, etc., etc. In this regard, it's also important to raise issue regarding who are taking the decisions and also working with the communities and working with the society, because we all know lots of abortion stigma around, yeah? When the young girls, young women are going to the services, to healthcare providers. I don't want to be really generalize all healthcare providers, but often, for example, they are reported that healthcare providers refusing to give the services only because they are underage, only because they are unmarried, only because the religion beliefs, etc., etc. When we are talking about human rights, it's also, again, the dignity, the person is the center, the human being in the center of all services in the regard. And it's also linkage to the LGBTI people who are having more pressure, who are having more difficulties in getting the services when they are going to gynecologists or other healthcare providers. And it's especially linked to the, for example, we could have this on HIV prevention or other STIs, like beating the globally. And it's also important to mention about the gender and sexual based violence happening while having these services, while having this going to the different parts, for example, moving from one city to another just to take one or two services because she couldn't do in her own town, own village, because everyone will know and they will be, she or they will be in danger. Thank you.
Thank you so much. And with that, I think you've done the most amazing wrap up of this particular webinar today, Uluk. And I think that all of us have been much more wiser, having listened to Emily as she presented that human rights-based approach tool, from Zuhura, who's giving us a clear perspective from governance and the Ministry of Health, Elijah from a human rights perspective and a national human rights institution, and for you, Uluk, for bringing us the youth perspective, but bringing us broadly the different kinds of challenges, but the solutions as well to a lot of these challenges. And thank you to all of you who've joined us on this webinar from across the world. You know how important these conversations are to us, and it is because of you as our community that we keep having these conversations. And I want to say thank you to UNFPA for being our partner for this particular conversation. And of course, we are commemorating the 75th anniversary of the Universal Declaration of Human Rights. So I couldn't think of a better moment to have this conversation. And of course, to my ICFP community, to all of my siblings, my family in ICFP, lots of love to you as well. And remember, as usual, all our conversations of the Pulse with Dr. T and all our other webinars will be recorded, and you can listen to them on demand. You can share them with your communities as well across the world on the icfp.org website, as well as our other previously recorded episodes as well. And again, thank you to all of you for joining this conversation. I think one thing I can say before we say goodbye is that human rights are central, human rights are solution-orientated, human rights are foundational. They are what connects us and not what divides us. And so to any problem, any obstacle we think we have, any challenge that we think we have, the solution will always be first and foremost protecting and promoting human rights of individuals so that they can thrive and more than just survive in their communities. And we know that access to modern contraception methods, access to family planning, and the entire comprehensive solutions and health solutions are key to upholding human rights and the dignity of all people. And as we wrap up today's episode of The Pulse with Dr. T, I want to say thank you again to my panelists for joining and the team behind the scenes technically, and again for UNFPA for being such an amazing partner to bring this information forward as we go and transform. Let it be a commitment. We're taking a step to transform all of our programs, all of our clinical care. We are transforming every healthcare system in the world and policies in the world to make sure that they are aligned to human rights. And with that, I would like to say thank you very much, everyone, for joining us. And this has been a delight. You will find more again on this conversation, theicfp.org. Thank you so much. And that it is it from me, from Dr. T and the panelists. Goodbye.